The hidden danger, understanding peptic ulcers. Deep inside the body, a peptic ulcer forms as an open sore in the lining of the stomach or the small intestine. One of the most common culprits is the H. pylori bacteria, which sneaks into the stomach and destroys the protective mucus layer. Many people don't realize that taking too many pain relievers like aspirin or ibuprofen over a long time can damage their stomach. Bad habits like smoking and drinking alcohol act like fuel to the fire, making the stomach acid even more corrosive and harmful. Extreme psychological stress and severe physical illnesses can also trigger these painful ulcers, leaving the body vulnerable and hurting. By understanding these causes, we can take the right steps to heal our bodies and prevent these painful sores from returning.
The hidden pain of peptic ulcers. Imagine feeling a sharp, burning sensation in your upper abdomen that hits hardest a few hours after eating or wakes you up at night. Some people find temporary relief by eating, but soon they struggle with bloating, constant belching, and a worrying loss of appetite. Things get serious when symptoms like vomiting blood or passing black, tarry stools appear, leaving the person feeling exhausted and weak. To find the cause, a doctor performs a detailed physical exam and uses an endoscopy, the gold standard for seeing inside the stomach. Special tests are then run to check for H. pylori bacteria through breath, stool, or blood samples to confirm the infection. From blood counts to barium X-rays, these diagnostic steps ensure the right treatment is started to heal the ulcer and restore health.
The secret to healing your stomach. Meet Mark, who is struggling with severe stomach pain. His doctor explains that the first step is using PPIs and H2 blockers to reduce acid. To fully recover, Mark must fight the H. pylori bacteria with strong antibiotics and stop taking harmful NSAID painkillers immediately. Changing habits is key. Mark learns to avoid smoking, alcohol, and spicy trigger foods, choosing small and regular healthy meals instead. In severe cases where medicine fails, surgical options like vagotomy or gastrectomy are used to repair the damaged stomach lining. Nursing care is vital during recovery. Nurses carefully monitor Mark's vital signs and check for any signs of internal bleeding. With the right medicine, a healthy diet, and great nursing care, Mark finally feels healthy and pain-free again.
Mastering gastric ulcer nursing care. The process begins with a thorough assessment where the nurse monitors vital signs and checks for signs of gastrointestinal bleeding. Careful interventions are key, including administering medications on time and encouraging the patient to eat small, frequent, and healthy meals. Patients must be taught to avoid spicy foods, caffeine, and smoking, while using relaxation techniques to keep their stress levels low. Education is vital. The nurse explains the danger of self-medicating with NSAID painkillers and the importance of finishing all antibiotics. It is critical to recognize emergency signs like vomiting blood or black stools, which could indicate severe complications like perforation. With proper nursing management and patient compliance, the risk of recurrence and anemia is reduced, leading to a full recovery.